Hi everybody. This is take 1,000,000, and if the phone rings or anything else happens, I am not going to stop recording because I've stopped recording 100,000 times. This is another surgery video. Oh, by the way, this is a wet set on my hair. It's not a style. I'm not trying to go for anything. I'm just trying to keep curlers on my head, so please save any comments you have about my hair or the thing on my head, because that's just curlers. So what I want to talk about today, in terms of surgery and surgery in the Dominican Republic, as usual, is what you might call haters or naysayers or people in your life for one reason or other who you've chosen to loop in on the decision or who have heard about the decision that you've made and have decided to give you their unsolicited input. And I just want to talk about different strategies for dealing with that because it is a hassle for a lot of dolls. And it shouldn't be, but it is, and chances are you're going to deal with it at some point. So I just wanted to go into that a little bit. So I think the very first thing that you need to do before you start talking to anybody about surgery or setting a date or anything is you really have to 100% decide. This has to be a decision that you are 100% clear about. This is what you want to do. This is what you're doing. You have your reasons. Every other possible thing, there's no way you get back out of it because it's very hard for you to make a case for yourself when you're not 100% in. So definitely make sure that you don't have any lingering doubts because the first time somebody comes up on you and starts trying to pick at them and get you to feel insecure or second guess your decision, those will not work in your favor. So really be 100% sure because, that is a huge step in kind of keeping that negativity and that type of static that you don't need while you're trying to plan for this out of your life. And the second thing you can do is research. Now, research is a term that can be kind of loaded when it comes to the internet, when it comes to non-medical professionals, which most of us are. But it still helps if you make sure that you look up all the things you see. If you see something negative, make sure you read about it and research it and try to find out all the details. Somebody may show you an article about somebody who had plastic surgery and died, or anything negative like that, and just make sure you're aware of it so somebody's not surprising you with information, and you can come back and say, yes, I'm aware of this and this is my decision about. Well, if you want to, you don't ever have to explain yourself to anybody, obviously. So that's really very important. And also, arm yourself with statistics, arm yourself with data, arm yourself with anything that you might need if you feel there's somebody in your life you need to explain this to. And again, you don't need to explain it to anybody because it's nobody's business but your own. But make sure that you look up the mortality rates and things like that for all the different procedures. Know the statistics about your surgeon. If your surgeon has had any adverse incidents that people might find out about, make sure you know about them first so you can explain that that you factored that in to your decision and you still made the decision that you did. And this kind of circles back to another thing that I've found in discussing this with various people, because I'm being very open about it. I'm not telling anybody because I'm in a position where it doesn't really help me to do that. So I'll tell anybody about it. And excuse me, I'm sorry. What I keep seeing repeatedly and annoyingly is that a lot of people actually have no idea what any of these common procedures are. And the procedures most commonly involved with or linked with my makeover, tummy tuck, breast lift and or augmentation, liposuction or liposculpture. A Brazilian butt lift is common in some places, not all, more common in the Dominican Republic as part of the surgery, and some people get brachioplasty, which is an arm lift. So, again, I'm sorry. One of the things I keep seeing from people, who are just kind of initially having this conversation with me and have decided this is not something that they think I should do, who have not done as much research as me on the subject, obviously, because it's just a conversation for them and it's my life. They don't actually understand what those procedures are. I had people say things about plastic surgery being lazy and it being the lazy way out or the easy way out, and that's really mystifying to me because it seems that these people think that plastic surgery is something you do instead of diet or exercise. And the reason why people get arm lifts, tummy tucks, and surgeries like that are because those are areas that can't be addressed through diet and exercise. That's why those surgeries exist. The same thing with liposuction. Liposuction is not a weight loss technique. Not that much fat can be removed from a person's body in any one given operation. It's not safe. So it's really just a matter of, moving stubborn pockets of fat that are making a person's life difficult or annoying. I mean, it's a surgery. It's not something somebody's going to get on a whim. So people don't understand that, so they really need to, you need to explain to them that it has nothing to do with, taking the easy way out or not dieting, exercising, or even vanity. These are usually procedures that aren't, for the average patient, it's not seeking perfection. It's just kind of seeking these minor changes, particularly with mommy makeovers. For things that have been bothering you since you've had kids. So, it's not like you're, a famous person who's going to get a bunch of surgeries and look like a model. You're just going to look more like you want to look. And that's your right. And there's nothing wrong with that. And there's nothing wrong with you. Don't let anybody make you feel bad about that. And same thing with, the other half of it is a breast augmentation. This one really mystifies me because, people will say, oh, well, why don't you, not take the easy way out, or why don't you work on that? Like, what can you do to make your breasts bigger? Or lift them even. There's nothing you can do exercise-wise, diet, literally nothing. There's, zero you can do without surgery to address that. So I just kind of wanted to go into that because I think a lot of times when somebody starts hating on you, and this is such a sensitive subject for you because it's your surgery, you kind of feel, broadsided, like this person is supposed to care about me and all of a sudden they're coming at me and why can't they be happy for me? And it is a very difficult thing to deal with. So, and the last thing that I think is important when it comes to dealing with haters and people who are, haters, I know everybody hates that word, it's an immature word, but it's very comprehensive to describe people that are just being negative when there's no real call for it. If you say to somebody, I don't know about this, help me decide, then that's a reasonable time for them to say, well, I don't know, blah, blah, blah. But if you say, I've decided this, people can voice their concerns, but there's a point where that respectfully will stop. If they voice their concerns and you've said, I've considered your concerns, but they haven't affected my decision, then the conversation should stop. Nobody should bother you beyond that. There's no reason why. Plastic surgery hasn't proved to be so dangerous that, somebody needs an intervention or to stop you. People should leave you alone. And, you shouldn't be afraid to tell somebody, I'm not discussing it with you anymore. I told you what I'm doing, and that's it. Because it's really not anybody's business but your own. You have to live with your body, and if this is something that you feel that you want or need to do to live with your body, that is 100% your right. So don't let anybody take that away from you. And then, excuse me again. The last thing that I wanted to say in terms of strategies for dealing with haters is, accept that there will be some people, or maybe some people in your life who will just never be comfortable with it, even though it's not their business. They will continue to harangue you until you get your surgery. They may criticize you afterwards. They may tell other people about it in an attempt to either shame you or in the beginning to get you to change your decision, and then afterwards because they're unhappy that you didn't take their advice. So you just have to accept that those people, their opinion is entirely irrelevant. It couldn't be more irrelevant. If you're happy and this is something you've wanted to do and you're getting the chance to do it, don't let anybody else interfere with that. You know, if they think plastic surgery is vain, or if they think, if they don't understand the medical science behind it, and they think there's some way that you can diet and exercise to increase your breast size, then, that's them, that's their problem, that's their ignorance, that's their judgment, and it really has no place in your surgical planning. And that doesn't mean that it doesn't hurt sometimes if somebody close to you has decided to judge you, or to bother you about it, or to tell you that it's a vain or selfish thing to do. And I think that probably disproportionately more women get plastic surgery than men, for a variety of reasons I won't go into. But I've noticed in my own life, it seems like men don't get as much pushback for their personal decisions. So, there will be people who try to, especially I've found in my own experience, if you're not partnered, if you're not married, visibly, people will intrude on your decisions and your life and things to an unbelievable degree. I was married when I was younger, and then I was not married for a while, and I got married again this year, but in the interim period, going from being a young married person to being a, not much older unmarried person, I realized that when I didn't have a husband, people got a lot more aggressive in forcefully interfering in my life, interfering in my decisions, to the point where if I said no thank you, they would go ahead and do things anyway. And it's upsetting, it's jarring, you feel, I don't think victimized is the right word, but you feel like your agency has been taken away from you, so that's really to the side of the point. But I just don't want people to think that if they're getting a ton of pushback, that it's just you, that, everybody else in the doll community is kind of sailing along on this journey with, all 100% acceptance. That's not the case. A lot of people deal with unapproving parents, unapproving friends, unapproving family, or disapproving. And, that's just something that's part of this experience. And hopefully I've helped you with some strategies to at least mitigate its effect on you, because that's the important thing. If they want to go off and be mad or over your life, or if they want to go off and be upset about what you've chosen to do, then that's on them. There's no reason why a person should be that invested in what you choose to do. And if they are, they have a problem. You don't have a problem. And your only obligation, if you want to, it's not really an obligation, is to attempt to make them more comfortable with their feelings. And if you get tired of doing that, you have every right to walk away from that person until they decide to behave. And if you have any questions or any requests, please let me know, and thank you again for watching.